In this video, I want to do a quick case presentation for one of my patients that came into one of the clinics that I work in Arlington, Texas. This child came in with her parent, and they looks like they have gone to the dentist, but it seems like just their home oral health care is not very good. Because they have a stainless steel crown here, they have another stainless steel crown here, they have a big cavity here, and then they have what is known as a band and loop space maintainer here. So they lost this baby tooth here, and this particular dentist or pediatric dentist ended up putting in this loop here so they can preserve this space here. Now this is a permanent tooth here. This is tooth number 19, and then this is tooth number 30. So these are coming in now. The child is probably about 6, maybe 7 years of age, and these permanent teeth are already having big cavities in them. And this is not a good thing because now this tooth is compromised, and they're gonna need this tooth, really for the rest of their lives. So in this particular kind of case, since the roots are still developing down here, what you end up doing is you end up cleaning this out and then putting some kind of liner here. You don't do a full root canal, at least I don't, because the roots are still developing. You put a liner here, and then you put a composite here, and then later I'll probably end up putting a stainless steel crown like this. And once the roots are fully formed below it, then you can come back and do a regular crown. These stainless steel crowns are just more temporary because the teeth are still growing, and so you don't want to do a regular PFM crown or a gold crown or anything like this. But this is a case of really just neglect, patient not brushing their teeth, or their parent not telling them to do a good job to brush their teeth. And when you end up with cases like this, then they'll end up needing these stainless steel crowns, space maintainers. Here's another stainless steel crown. But you can prevent all of this really by just brushing your teeth twice a day, flossing every day, because to be able to get something like this done, it takes a lot of work. It takes a lot of work, not just for the child, it takes a lot of work for the dentist. It takes a lot of work for the parent, because sometimes you have to take the kid in and out of school to bring them to their dental appointments, and that's very, very draining. And then the kids sometimes can get traumatized depending on what's happening in that particular appointment. So you want to prevent this. This is a case that you don't want to go there. I'm gonna go to the next picture here. Here's another view of it. Again, same case. And then let's see. Here's the top arch of that same patient. They had a stainless steel crown here on this particular tooth. So now I applaud the mom for the patient, the patient's parent, for bringing the child in to get their teeth checked. But again, this patient has a lot of stainless steel crowns, and that shouldn't be happening. I mean, you got 1, 2, they've lost this tooth, and then you got 3 here, another stainless steel crown. So this is a case which it really gets to your heart, because you want to help out these kids so that they're not having to go through situations like this. Again, here's the same case with the space maintainer here, and I want to see if I can here was the other one on the other side. I want to see if I can zoom in a little bit so you can see that clearly. That's a stainless steel crown. Very well done. Very, very well done stainless steel crown. This should stay in there for a long time until the patient loses this tooth, and this is replaced by a premolar, which is down here, and then another premolar, which is down here. They'll come in and replace these teeth. Typically, we put these in the mouth because doing a filling in these baby teeth, typically those fillings don't last a long time. They come out, and then you have to keep redoing them. But if you do a stainless steel crown and it's been correctly done, then you can preserve the tooth in the mouth, and then the patient doesn't have to keep coming back for several appointments in the future for their dental appointments. Here's a banded loop just on this one side, so that I could show it clearly. Here it is. So there's a permanent tooth down here that's not hasn't come in yet, and if you don't put this space maintainer here, this space here is going to collapse, and when that collapses, then this tooth is not going to come out. Then you're going to have to do something else to try to bring this tooth out. You have to sometimes do what is known as a bonded expose and bond, where you expose the tissue and then you put a bracket here and then you try to pull that tooth out. So the way we do that to prevent doing that is we just put this stainless steel crown here. We put a band around it to hold this space, and then when this tooth begins to show up here and then we remove this, then it's able to move into place. But if you don't do this, you can end up with a lot of malocclusions, just bad bite, crowding, wrong spacing in your child's teeth. So this is why you want to do these space maintainers. Now this is one type. There's several different types of space maintainers. You can have these wrapping around all the way down to the other side of the mouth on this side here, but each case is going to be different in what the patient needs. In this case here, I have a space maintainer or a stainless steel crown that I wanted to show on a model. Here it is. They did good. They did a good job. Now, here's a case in which you would need a space maintainer. So if this tooth was lost, was extracted to whatever reason, this tooth here would want to move into that and collapse this space. And then if there's a permanent tooth down here, then that tooth is not going to come out. So in this case, you would end up needing a space maintainer. Okay. Here's another case in which you would end up needing a space maintainer. Well, the same case actually, just from a different view. So again, they've lost this baby tooth here. There's a permanent tooth below here that's developing. If you don't put something to hold this space here, it's gonna collapse, and that tooth that's below here is not gonna come in. Then you're gonna end up with a whole lot of issues down the road. So anyways, this is why I believe it's important for you to take your kids to the dentist. For kids typically up to the age of 3, we recommend that they come in every 3 months. Then after that, they come in every 4 months. That way you can prevent a lot of the cavities, so that your kids don't have to go through these stainless steel crowns like this, or if they end up losing a tooth prematurely like this one here, they don't end up needing a stainless steel crown, because again, really it's just it's a lot of work to do all of that. And this is why I believe you should go to the dentist regularly. Floss your kids' teeth on a nightly basis. Brush them every single day. If you do these things, you should prevent a lot of these cases from happening. And we've done a lot of stainless steel crowns here in our clinic, and we hope that we can do them for you and your kids if your kid has a lot of cavities in their mouth. Okay, this is Dr. Kachepa from Inwood Dental. I'd love to see you again in my clinic to be able to help you out with your child's teeth. If your child has a lot of cavities and you need somebody to do them, we do them here at Inwood Dental. Okay, thanks, bye.